It really is a mixed bag. We have a very large country, very heterogeneous, major differences, for example, between the New York metropolitan area and Casper, Wyoming. If you look at how we've been hit badly. I mean, anybody who looks at the numbers, we've had now over 120,000 deaths, and we've had 2.5 million infections. So it's a serious situation. In some respects, we've done very well. Right now, for example, the New York metropolitan area, which has been hit extraordinarily hard, has done very well in bringing the cases down and using the guidelines that we have very carefully put together in a stepwise fashion to try and carefully reopen their city and their state. However, in other areas of the country, we're now seeing a disturbing surge of infections that looks like it's a combination, but one of the things is an increase in community spread. And that's something that I'm really quite concerned about that. And you know that this has been something that's been in the press over the past couple of days, where we were going down from 30,000 to 25 to 20, and now we sort of stayed about flat, and now we're going up. A couple of days ago, there were 30,000 new infections. That's very troublesome to me. The way you address that, and I've said this over and over again, is you have to have the manpower, the system, the testing to identify, isolate, and contact trace in an effective way so that when you see those increases, you can understand where they're coming from and you can do something about them. Right now, the next couple of weeks are going to be critical in our ability to address those surgings that we're seeing in Florida, in Texas, in Arizona, and in other states. They're not the only ones that are having a difficulty. Bottom line, Mr. Chairman, it's a mixed bag. Some good and some now we have a problem with.
All right, now I'm going to have to ask about the president because you talked about testing and how important it is, and Admiral Giroir and I know how important it is. At his rally over the weekend, the president said, and I quote, "When you do testing to that extent, you're going to find more people, you're going to find more cases. So I said to my people, slow the testing down, please," unquote. And this morning he said he meant this. So Dr. Fauci, do you agree with that? Does it make sense that to safely open our economy, we should be limiting the number of tests rather than ensuring that anyone who needs a test can get one? And you don't have to mention the president, I did, but tell us about the testing. And
so I, as a member of the task force,
your microphone is on.
Sorry. I, as a member of the task force, and my colleagues on the task force, to my knowledge, I know for sure, but to my knowledge, none of us have ever been told to slow down on testing. That just is a fact. In fact, we will be doing more testing, as you've heard from Admiral Giroir, not only testing to specifically identify people in the identify, isolate, and contact trace, but also much more surveillance if you want to get your arms around and understand exactly what's going on in community spread. So it's the opposite. We're going to be doing more testing, not less.